Okay, so the first test is the Cozen's test. You're going to have your patient in slight elbow flexion, wrist extension, and radial deviation. I'm going to put my fingers over the second, third metacarpals and palpate the lateral epicondyle with my other hand. I'm going to pull them into wrist flexion and ulnar deviation. So can you hold that there for me? All right. A positive sign would be pain over the lateral epicondyle. To differentiate between ECRB and ECRL, I'll move my fingers to the supracondylar ridge and put them in a little more elbow extension and do the same motion. Hold that there. A positive sign for this test would be pain over the supracondylar ridge. The next test is the Mills test. So you're going to start your patient in elbow flexion while palpating the lateral epicondyle. I'm then going to passively take them into elbow extension, pronation, and wrist flexion. And a positive sign here would be pain over the lateral epicondyle. The next test is the third digit resisted extension test. So to begin, you're going to have your patient's hand resting on the table with their palm down. I'm then going to palpate the extensor digitorum and ask the patient to raise their middle finger in the air. I'm going to ask the patient to hold it there while I apply some resistance. Alrighty, a positive sign for this test would be pain over the extensor digitorum, which could mean that they have some lateral epicondylitis. The next test is the golfer's elbow test. So you're going to have your patient in elbow flexion and full supination while palpating the medial epicondyle. You're then going to passively bring them into elbow extension, wrist extension, finger extension, and some radial deviation. A positive sign here would be pain over the medial epicondyle, which could be consistent with medial epicondylitis. The next test is the valgus stress test. For this test, I'm going to be applying a medial force to the proximal forearm as well as a lateral force to the distal forearm, just like this. This test is testing the integrity of the MCL, so a positive sign would be pain over the medial epicondyle. You can also do this test in different positions of the elbow to target the different bands of the MCL. The next test is the varus stress test. For this test, I will be applying a lateral force to the proximal forearm as well as a medial force to the distal forearm. A positive sign here would be pain over the LCL. The next test is the moving valgus stress test. For this test, you're going to have your patient in abduction, you can relax, elbow flexion, and you're going to externally rotate the humerus to put a valgus stress on the elbow. You're then going to bring them into full elbow extension, maintaining that valgus stress. A positive sign here would be pain over the medial epicondyle where the MCL is. The next test is the elbow flexion test. So to begin, you would have your patient put their arms into anatomical position like this. You would then ask them to fully flex their elbows and extend the wrists. You would have them hold that there for 3 minutes. A positive sign here would be pain or numbness and tingling over the ulnar nerve distribution. The next test is the Tinel sign. For this test, you'll be tapping the posterior aspect of the elbow just above the cubital tunnel, like this. A positive sign here would be pain or numbness and tingling over the ulnar nerve distribution. The next test is the Wartenberg sign. For this test, you will have your patient rest their hand on the table and ask them to put their fingers in full abduction like this. You will then ask them to adduct their fingers fully, just like this. Because he was able to do so, that would be a negative sign. A positive sign would be if they could adduct all their fingers but their 5th digit. This next test will be testing pronator teres syndrome. So you'll have your patient in 90 degrees of elbow flexion and full pronation. I will then resist that pronation while extending their elbow. A positive sign here would be pain or numbness and tingling over the median nerve distribution. The next test is the posterior rotary stability test. For this test, you will have your patient in about 130 degrees of shoulder flexion. You will then be applying a valgus load as well as an axial load to their elbow and supinating their forearm. A positive sign for this test would be pain over the LCL. This next test is the upper limb tension test 1. For this test, you will have your patient in 90 degrees of abduction with their hand pronated. You will then bring them into elbow extension, wrist extension, and finger extension. A positive sign here would be pain or numbness and tingling over the median nerve distribution. This next test is the upper limb tension test 2. For this test, your patient will be in the same position as the first test. I will stabilize the scapula and bring them into elbow extension, wrist extension, and finger extension, but apply some external rotation. A positive sign for this test would be pain, numbness, and tingling or pull over the axillary, musculocutaneous, or median nerve. This next test is the upper limb tension test 3, which targets the radial nerve. So first you will bring your patient into 90 degrees of abduction. You will have them make a fist, but tuck their thumb underneath their fingers. You will then depress the scapula and bring the wrist into flexion, ulnar deviation, and extend the elbow. A positive sign here would be pain over the radial nerve distribution. This last test is the upper limb tension test 4, which targets the ulnar nerve. Your patient will start in abduction, elbow extension, wrist extension, as well as finger extension. You will then bring the patient into pronation, elbow flexion, and radial deviation. A positive sign here would be pain or pulling over the ulnar nerve distribution.